So, starting off this discussion or reflection is what is the purpose of the Movement Summit? So, when I was watching the Movement Summit, they talked about how all these physical therapists, that wanted to optimize movement and had their own ideas come together at this little conference to sort of collaborate and, be very open minded to others' opinions about, how we can integrate this movement system and how we can improve it and educate others, to do the same and educate other health professionals of who we are and, not just what we are as physical therapy. Like they said, we don't want physical therapy to be a verb. We want it to be something that we are and we're experts of with those techniques. And we're also experts in other systems. That's why they're creating the movement system. So when we talk about identity for a physical therapist, our identity is basically, you know, to optimize movement for the health of the individual. So, we take everything that we can from saying that and applying it, every single day. And basically, at the end of the day, it becomes our identity. That's who we are. We help people, with movement and not just based on, how they walk or how they move. It's based on so many other different things. And that's why I believe this movement system was created. So, how do physical therapists fit into the movement system? I believe we fit into the movement system because obviously physical therapists are experts of movement, and our mission statement explicitly says to optimize movement of the person, but also we fit into the movement of systems because we know the systems that are attributed to this movement system. We were educated from cells all the way up to real life organisms, and with all this knowledge we can provide the education, we can diagnose certain things, and we can know the parameters for many different pathological conditions that we could diagnose and pass on to their physician. I believe if we are movement system experts, we would, gain a little bit more respect from healthcare professionals, as well as individuals in the community. It also shines a lot of light onto, what we do and what we can do, because a lot of people would think, oh, they're just, muscles and bones. But there's much more to movement systems than that. It's the system as a whole, because every system in the body is going to affect, how we move. And with that being said, it brings a lot more educational opportunities for healthcare professionals as well as the individuals in the community. I believe the patient care management model will fit very well with the movement systems idea because as PTs now, we already do the examination, create an evaluation, come up with a diagnosis, prognosis, intervention, and outcomes. And if other healthcare professionals can use similar terminology, it'll be a lot easier to flow through that patient care management model, rather than get stuck on a step possibly or wait for a physician to get back to you on certain things. When doing a movement system analysis, I believe it's very important to, first of all, get the signs and symptoms of the person. Definitely get baseline measurements, heart rate, BP, O2 saturation, new symptoms possibly, and looking at the person as a whole, as a whole system, not just as an individual coming in with a specific reason, but again, look at them as a whole. It's there's a lot of information you can find out if you try hard and use the knowledge that you've gained in a physical therapy program to create a diagnosis. When working with the individual, you always want to ask if there's any pain, especially in any systems pertaining to the movement system. And just listen to the patient. Everyone likes to be heard, so when you're listening to them, look for things like, oh, it hurts when I walk, or I'm walking differently, or anything that has to do with movement. Definitely pay attention to, because the patient is really who feels it and feels what.